In the summer, we slather on that sunscreen and we really seem to pay attention to our skin. But when winter strikes, we tend to ignore it. It's important to minimize the toll that the next few months of winter will take on your skin. So here's Dr. Fred Weksberg with more on what you can do.
As Canadians, we're very tough. But when it comes to the skin, we do need some help and advice when it comes to taking care of our skin during the winter. So let's go through a typical day of a Canadian in the winter. First thing that we want to do is when we get up in the morning, we want to make sure our humidifier is working, refill it for the day so that we have moisture in the air. The next thing that we want to do is cleanse our skin. So we have a variety of cleansers. We have some cleansers which abrade a little bit, that exfoliate a little bit, but we have to make sure that it's very gentle. So exfoliating gently with a cleanser 2 or 3 times a week is a good idea to take away the dead skin cells and help to rejuvenate the skin. The next thing that we do is when we take our showers, we want to make sure that it's warm and not too hot. Very hot water will take away that oil, make our skin dry, starts to crack, starts to peel, it gives us eczema. So make sure that the showers are warm but not too hot. And it's a perfect time when our skin is damp after the shower to start with moisturizers. And this is what's key. Remember that moisturizers can be very oily, and on the face this can cause acne. So try and use a water-based moisturizer on your face. But when it comes to the body, especially the hands and feet, we want to use thicker moisturizers. Now, when you want to pick a moisturizer, you might want to get the help of the dermatologist. In particular, in my office, I use a Clarity UV application, which is an iPad application, which takes a picture of the patient and then can convert it and show the UV damage. And by that, we can see how and what we need to use for treatment. So the next thing that we want to do is to help our skin get healthy. So we want to use antioxidants, especially in the wintertime. CIC2, retinol, and a variety of other antioxidants are excellent to choose from. And again, your dermatologist will give you advice about that. Peels are very important. There are special peels that we can do as dermatologists in the office, such as this dermaceutic peel, or there are special home kits that we can use. And again, we can give you advice upon that. Another popular misconception is that people don't think that they need to use sunscreens in the wintertime. And that's the furthest thing from the truth, because it's not the temperature which is important, it's the ultraviolet rays. And there's a lot of sun reflection off the snow, so it's crucial to use sunscreens and reduce the UV damage. There's lots of excellent ones. We have some ones here by DCL, by Zeo, and there's a very nice one here for patients who have acne because this doesn't clog the pores. It's a mineral type of sunscreen. It's called Color Science and can be used just on the face, and it's applied just like this, so you can keep it in your pocket, you can keep it in your purse, and very important when you get up in the morning before you're going to go outside, put sunscreens on even in the wintertime.
It's clear that taking care of your skin is 12 months a year, and that important point that he made, don't forget your sunscreen even in the winter months. If you'd like more information on this and anything you see on the show, be sure to check out our website.